This is Dr. B. Murali Mohan, consultant intervention pulmonologist and sleep specialist at Renova Hospitals, Kompally. Tuberculosis. Tuberculosis is caused by Mycobacterium tuberculosis. It mainly affects the lungs. India is endemic for tuberculosis. In India, in 2020-21, in 2021, 2.7 million people are affected with tuberculosis. In 2017, 4 lakh people died because of tuberculosis in India. Tuberculosis mainly affects lungs. There is no age limit. It can affect newborn, pediatric, adult. At any age group, it can affect any organ except hair and nails. Most common symptoms of tuberculosis are fever, cough with sputum production persisting for more than 2 weeks, loss of weight, loss of appetite, fatigue, night sweats. The classic symptom in tuberculosis patients is evening rise of temperature. The fever starts in the evening hours around 4 p.m. in the evening, and it will reach peak in the early hours in the morning. The temperature will be very high grade, more than 100 degrees Fahrenheit. If the patient is not diagnosed, then this patient is more prone for spreading to others. There are 3 stages of TB: exposure, latent, and active TB. In India, when a child is born, BCG vaccine is given immediately. But BCG vaccination does not protect 100% from tuberculosis. It depends on the patient's immunity. Diagnosis of tuberculosis is done by sputum for AFB and CB-NAT test. These are the 2 tests which help in diagnosis of tuberculosis. If the patient is not diagnosed in these 2 tests, then bronchoscopy is planned depending on the site of the lesion in the lungs. Once the patient is diagnosed to have tuberculosis, 4 drugs are given for 2 months and 3 drugs are given for 4 months. Total duration of treatment is 6 months. Even for pregnant ladies, newborns, we treat with the same treatment. In newborns, we don't give ethambutol.